Sì, ringrazio tutti di essere qua, presidenti, moderatori.
I would like to thank everyone for inviting me, Francesco Marangoni, Eufoton, that every year organizes this wonderful event. I'm already looking forward to next year's event, because it's interesting to compare what we do, how we do it, and update our technique and compare our problems with our peers. I want to talk about liposuction and laserlipolysis, the birth of endolift, I would say. And Dr. Forte later on will talk about endolift and face and body. When in 2005 we started the laser liposuction, we realized that from American studies carried out by Affenberg, well, the first study said that the interaction of laser and wavelength with certain colors had an impact on what we wanted to achieve clinically, especially in the 1470 wavelength hits water and fat and selects what we want to cancel and destroy the fat, so obtaining our result. Because we either destroy the fat, removing it, or leaving it in place. But anyway, we have to destroy the fat. The nice thing about this methodology was having the possibility of being super selective, so not having other chromophores, other risks towards what can be the vessels or the lymphatic tissues. So being selective on fat that you see in yellow here, and then proceed with the endolift tightening. In 2006, we realized that FDA approved laser lipolysis as a main technique to be effective selectively on fat. But the studies that brought to the approval of the FDA was a study that compared liposuction with laser lipolysis and liposuction to check if after the treatment the patient would have a laxity. You know, when you did the liposuction in the old way, like in the internal part of the thigh of the arm, you know, these were the weak spots because there was sagging. So if we take away fat from an area and we don't do a tightening, the skin will sag, especially in certain areas. And then there are areas like the culotte de cheval, the inner part of the knee, or other, where there are no other tissues that sag, like the internal part of the thigh of the arm. So there's a quantity of fat that we have to try and destroy. So the question was, if the addition of laser could spur tightening of the skin. So the researchers looked at the extent of skin tightening in nearly 2,200 women and men who received the treatment in several parts of the body and face, and Dr. Chamsuddin, who was the study leader author of this FDA certification in 2006, certified that the amount of skin tightening with laser liposuction is about 50% better than what would have been achieved with traditional liposuction. So this makes us understand that the tightening effect is present during laser liposuction and lipolysis. What does it mean? It means that when we work with micro cannula in the tissue, we carry out a selective treatment and less aggressive compared to the other tissues. If we have a Mercedes, a 3, 4, 5 cannula, it's more aggressive, it's not selective against the fat that want to destroy, but creates a hollow situation, touching the septs, the blood vessels. So it makes a hollow. And with the compression and nature, of course, will create the tightening effect. But we want to create the tightening effect with the laser. So we have a wavelength which is specific, which destroys selectively fat. So there's a retraction of the connectival parts. And this allows us to have a result, a better result. In the same study, they also certified that fat absorbs energy, laser energy, better than the other energy. So tightening and the destruction of a fat is better if done with laser lipolysis. So when we justify, or when we want to promote a treatment with our patients, we can offer them something better than saying, well, the radio frequency works well, but the ultrasounds works better. No, laser lipolysis is certified as the best and most effective on fat. So I simply repeat the same thing. Laser lipolysis and laser liposuction are two methods where you selectively destroy the fat. Infiltration is the classical method created by Dr. Klein, which many doctors customize according to what they have. They use lidocaine or some other drugs, but it must be a tumescent technique because it creates a better thermal effect and photomechanic effect. So we have a better option of destroying the fat cells. Dr. Klein described this for the first time in 1986 with lidocaine, adrenaline, and sodium bicarbonate, which is very important because the add of sodium bicarbonate avoids the burning feeling during the injections. But another study was published in 1999 where the association of lidocaine and bicarbonate increases the antibacterial properties of this one. High contents of lidocaine, higher than 0.5%, inhibit bacterial growth, especially of gram-negative bacteria. So if we add sodium bicarbonate to lidocaine, this is a take-home message if you didn't know already, and it's very useful. How many of you do this kind of techniques, laser lipolysis or liposuction? Well, half of you, more or less. So trying to understand the results that we can obtain with different wavelengths was certified in this study by Young and Yoon in 2009, where the effects were compared with the Monte Carlo statistical method with different wavelengths, 1064, 1320, and 1470. The simulation was performed with homogeneous fat and dermal tissue. So with these different wavelengths, and 1470 show the highest ablation efficiency with minimal heat compared to the other two wavelengths. So as you see, the 1470 here on the right is more effective, so it destroys better the fat compared to the other two. And this is what we need to do, destroy fat. But by comparing the thermal and heat diffusion of the tissue, we have less heating. So in a nutshell, what happens, if we use the right wavelength, we have a high lipolytic effect with a lower thermal risk, because we use lower watts, plus our only target is yellow and fat and water, so it's very selective by reducing what we do, so reducing the risks and optimizing the result. Let's have a look at the devices. Well, the device is the 1470, the better device on the market, and if you are here, I hope that you all agree with me. Specific cannulas for liposuction, which are different from the traditional ones. So they are all Mercedes, but also 1.2 millimeter. So the insertion in the tissue is smaller, the access point. And sometimes the patient complains about that, so the size of the little hole. An important thing is the reshaping of the tissue, that we can always treat a scar even afterwards, but the smaller it is, the better. And then fibers, as Mr. Marangoni already said, 2, 3, 4, and 600 microns. And the novelty are these radial fibers, who have not only a closed, narrow angle diffusions, but also a radial diffusion 360 degrees on the tissue. And this allows us to have a more homogeneous treatment when we want to work in lipolysis on the tissue. This is how the fiber appears in the cannula. There's a radial diffusion of fiber, 360 degrees around the tip. Do you want to add something about radial fibers? So these are the classical. So the areas localized of excess fat are typically these. So it is certified F10, and we think it's more effective in fat and in tightening. It is also important for the prevention of skin laxity. So we have a better tightening effect in those complex areas like the internal part of the arm and of the thighs, which are the areas that we should keep more attention to. And then the correction of old style liposuction. So a smoothing effect. Also, if the patient underwent a previous treatment, that to have to correct. So to improve the results. So the area is pre-tunneled with the cannula, and the cannula then contains the fiber, which is inserted in the fat. At the beginning there can be a little resistance, but then there's a melting, as with traditional liposuction, and we can use the treatment. What we do, well, both skin tightening and lipolysis. We can work continuously, pulse light, so depending on what you feel. So the first times it is better to work not continuously, and then even more skin tightening, maybe working on the surface with fibers for probably the scraping. So the setting and jowls delivered depend on the patient. It must be customized according to the area of the treatment and the quantity of subcutaneous fat. And this is a study comparing the jowl quantities for each area in 980 nanometers. This study was published in, I don't remember when, anyway, a few years ago, and we are now comparing it with our experience with 1470, and we've seen that we cut by half the jowls, so it's more effective, more precise treatment, and quicker. The after treatment, of course, the usual compression bandage and the lymphatic drainage and photobiomodulation with LED. This is what I suggest after every treatment. I started in 2005 to perform these treatments. For medium to large areas, I prefer laser liposuction. For the smaller areas, we can decide either lipolysis or liposuction, which allows us to perform a very easy treatment under the chin, the knee, or small corrections like the one that you see here. But we can destroy the tissue with the laser and wait for the evolution This is a treatment of culotte de cheval and inner thighs, 2 sessions of laser lipolysis, the second after 3 months, and this is the post after 1 year. These are laser liposuction treatments. I'm sure that you all have great results also in small areas like the bulging of the abdomen or the culotte de cheval or the inner thigh. This is a patient by Zoran from Croatia with a wonderful result on tummy, culotte de cheval and hips. Another patient with a good reshaping of the culotte de cheval and inner thigh with a great result. The real difference to me in the result, be it with one technique or the other one, is the tightening of specific areas, like the inner thigh. And patients like these, who've got extra fat, cellulite, and mild skin laxity, should have a combined, holistic approach. So in this patient, that will be also treated by Professor Dinko Caliterna, he will talk about the specific treatment of cellulite to show like the holes. We can have this result just 3 days after I performed a reshaping of culotte de cheval, of the banana fold, and what are the problems of the glute. So the fiber and also tightening. So this is a video from Mr. Luigi Rizzi. So we can really perform a tightening of the tissue with the fiber. So a total reshaping of the several components, not only of the glute, but also of the entire area. You don't want only a good picture, you also want a good framework. So there are hematomas. I can do that even after 3 days to see what I don't see around the bandages, because the blue hue that you see in the lower right thigh is a good result. What did I do here? A little bit of lipostructure. When we destroy the fat, we can use this fat somehow. Maybe till some years ago I thought that the fat taken out with liposuction could not be vital. But then we started analyzing the tissue, and there's an Israeli study on 10 patients, a split side. So one side was treated with mechanical liposuction, the other one with laser liposuction, and the fat was analyzed, trying to understand the components of the fat treated with a traditional liposuction or laser liposuction. We've seen that the one with 1500 laser, the fat was made up of 98.9% of fat and a small amount of blood. So that's what we expected. Fat tissue, so almost fat and not many, but there's also a variable of more or less 2.7%. Why? For the harvested samples, mechanically, so with all the traditional liposuction was blood, 80%, adipose tissue, 60%, so way less than the laser lipolysis, lipids, connective tissue, fragments, oil droplets. So, with an average of 79.7% of quantity of adipocytes versus 95.7% of live adipocytes present in the new laser liposuction. So the quality of the fat harvested is better compared to the traditional classical liposuction. There's another important thing. This 95.7% has a 2.7% variability, while 79.7% is a variability of 18.3%. So you can get to 50% almost with your traditional technique. So the fat after a treatment will have more, will have a better quality compared to the traditional one. These are just pictures, examples of other patients in difficult areas. So I said with this patient, let's try and see how it goes, but this is a patient which has a laxity, but then he sent me this picture saying everything is fine, and you can see the quality of the result. This is not a professional picture, but you can see how wonderful the result is. Another patient. Of course, the credits are present in every picture because not all of the treatments were performed by me. Zoran had an incredible result. Tammy, in this case as well, this is another patient that I treated. After 3 days, there was a remodeling of the abdomen and the sides and gynecomastia after 3 days. So the study that confirmed the efficiency is by Trelles, which certified that it was a safe and effective skin retraction when you treat an area like the men's breast to correct the volume, the flaccidity and excess skin without excision. And the conclusion is that this is the gold standard. And this is the most aggressive invasive technique, but it also works on the gland. So to conclude, he says that the laser liposuction is a simple and effective technique, barely traumatic. So the concept is very simple. So the laser will help us a lot. And over the last 14 years when I started, well, the first experiences were in 2002, 2003, but then I started steadily in 2005. I replaced traditional liposuction in all the patients that I treated with less trauma on the tissue, faster procedure, less pain, less edema, hematomas, smaller incisions. So the patient is happy, with reduced possibility of waves, with a higher retraction of second skin, stimulation of the collagenesis, and elastic bandage compression will be kept for less time, with a faster recovery time. So, as of today, this can be considered the real gold standard for mini-invasive subcutaneous fat reduction in the big areas, but also middle localized fat cell areas. And I'm sure that it helped us and gave us advantages over conventional liposuction because it is more selective effect, respectful of the anatomy, gentle on the blood vessels, delivering minimally invasive tissue tightening and skin retraction. So we have the possibility of expanding the cohort of patients that will undergo this technique. Thank you.